Doctors of Reddit, what is the strangest thing a patient said they had that actually turned out to be true? Schizophrenic lady told us someone was trying to kill her. Turns out someone shot up her house in a drive-by while she was in the psych unit. Obligatory, not a doctor, but a medical student. On my mental health placement there was a guy I saw on a home visit who was convinced his neighbor was trying to kill him. This guy had a history of mental health problems and the doctors were sure he was psychotic. And all of this was in his head. However, a few days later the doctor went round for another home visit and found his neighbor trying to climb through the window with an axe. The poor man wasn't psychotic at all. His neighbor was actually trying to murder him. And everyone thought he was just mad. Inpatient psych ward when I was a medical student. We admitted a guy who was having psychotic delusions. He lived in a holler, a small valley between two mountains. For weeks. He had been absolutely preoccupied by this idea that the mountain was going to fall on his house. He would spend days at a time without sleep finding rocks, branches, and other junk and piling them up behind his house because the mountain's gonna fall down on my house. I guess this wasn't the first time this happened, because the family brought him in saying he was off his meds, working himself to death to build a pile of junk behind his house. He's admitted for a week or two. Goes to group therapy. Has his meds adjusted. And he's doing well. We decide he's being tuned up and ready to be discharged. His family comes to pick him up. But they have this grim look on their faces. We're bringing him back to the hotel. Yesterday there was a landslide. It destroyed the house. A patient walked in the clinic with a complaint of fever. I noticed his hands were very yellow. He did have a history of alcoholism but no other signs. I told him his hands suggest he is jaundiced and will need tests. He laughed and said, "Oh no. I just dusted my hands with turmeric." I tore the ligaments in my knee when I was 12 and the doctor had a difficult time getting the stitches out. One broke and he decided to leave it under my skin, telling my parents it would dissolve. When I was 16 I banged my knee against something and out popped the end of the stitch. I went to the doctor to get it removed. You could see a long curly blue thing under my skin. I insisted this was the remaining stitches. My doctor just thought it was a vein. She froze a small area around the protruding stitch and pulled on it. She pulled out 2 or 3 inches of curly stitching. She held it up, looking shocked, and said, "I have to go show the other doctors this," and left the room. My daughter had a fall on the trampoline when she was 3. She let out this really weird scream. Then went pale, quiet and sweaty, and wouldn't let us touch her arm. We only live 5 minutes from the hospital, so I put her in the car and drove there. She slept in the car. We get to the hospital and check in. And she's found her second wind. The triage nurse rolled her eyes at me when I asked for an x-ray, but ordered one anyway. At this point my daughter was literally pirouetting around the waiting room. I was starting to doubt myself. Even the x-ray technician was laughing at us. About 5 minutes after the x-ray is taken, a very red-faced triage nurse runs out to the waiting room and firmly tells me to stop my daughter from dancing. She's broken her arm and they don't know if she will need surgery or not. She didn't need surgery in the end but spent 6 weeks in a plaster cast. Turns out she's badass and has a great pain threshold. Love her. Not a doctor. Friend's son age 2 came home from daycare, said he had stuck an acorn up his nose. Mum looked. No acorn. Around 2.5 boy develops chronic throat and sinus infections, has 8 courses of antibiotics in a year. Age 4 boy is sent for tonsillectomy. Surgeon comes out of theater, shows mum a moldy rotten acorn. Turns out he did put an acorn up his nose. They left tonsils and boy ridiculously healthy ever since. Not a doctor, but a patient. In January this year, the side of my face grew bigger and bigger, and I was in extreme pain. I go to my GP and tell him looks like mumps, don't ya think? But he brushes it off, saying I got my vaccines. He sends me to the ER because he does not know what I have and how to treat it. After 5 hours in the ER, They finally get my blood tested for the mumps. Turns out you can still have the mumps even though you're vaccinated. I had a bone replacement surgery, up a third of the tibia, and it was fixed in place to heal with a titanium plaque and screws. One day the plaque broke, and I went to the ER and told the doctor that I had a broken piece of titanium and he called it bullshit. His face after seeing the x-ray with the plaque separated in two pieces was priceless. Not a doctor, but a combat medic in the army. Had a private heat stroke on me and on his journeys back and forth between consciousness. He stated my butthole hurt, but feel really good too in a slurred outburst. I looked at him, trying not to burst out laughing. Why yes, private. There's a rectal thermometer in your no square. A patient had a bullet in her ear. Occupational therapist here. I was gathering a social history on an elderly patient. Asked who she lives with. She told me she lives with her 6 dogs and 200 000 bees. I was like, yup, this lady has post-operative delirium. Called her son to get the real social history. He was like, yeah, she's a beekeeper and she adopts old dogs. Patient told me her head felt funny inside. She was intermittently confused. Her family thought she was just bullshitting to get some attention. One head CT later and she's got a big FCK off type bleed going on. Patient here. This is a case where the doctor called bullshit on what I had. Broke my arm once. There was a huge waiting time at local hospital, so I decided to go to another hospital the next morning. I slept really badly but managed to have like 3-4 hours of sleep. Instead of waiting the whole night awake in a waiting room. When I explained what happened to the doctor, she said it was not broken because if it was I would never be able to sleep with it. So I get used to the idea I did not break my arm. I stay there for the scans because it was swelled, and wait. The doctor came back with 2 pills of morphine saying I had incredible pain tolerance and that my arm broke at 3 places. She then explained I needed a surgery the same day and they are making place for it on the agenda. Had a larger patient complaining of abdominal wall pain ever since they were head-butted by a goat. CT scans never identified anything. On a whim got an ultrasound and saw this little cyst thing the size of a pea right where they were hurting. Told them no guarantees but I'd be willing to cut it out to see if it helps. Ended up cutting out an ellipse of tissue where the cyst thing was and all their pain was gone. Emergency doc here. I once had a woman come in after visiting her psychic. She went because she had been feeling just generally ill. Nothing specific. The psychic used some tarot cards and then told her that her dead grandmother was trying to warn her that she had Lyme disease. I totally doubted it. But you'd better believe I ordered the test just in case. The next day, the test came back, and she had it. Patient here. I broke the same rib 11 times over the course of 3 years. But the doctor often wouldn't even order an x-ray. She just said it wasn't healing right. Give it time. I tell her there's something else going on. She dismisses me. Finally, after the 11th time, she says fine, we'll x-ray. X-ray shows a mass. Mass is biopsied. I have a tumor. The tumor was weakening the bone to the point that it broke when I reached into an upper cabinet for the sugar. Had that bad boy, named him Adam, removed in 2018. 1 week hospital stay. Worst surgery I can imagine. And now I'm doing great. I was the patient in this situation. In 7th grade I was riding scooters with my little brother and I fell off when I hit a pothole, FCK Michigan, and when I fell I put my arms out in front me. I felt the worst pain in my right arm right from my funny bone. I have never screamed so loud and I still had to walk home. My brother was freaked out and I kept telling him I broke my funny bone. I broke my funny bone. We finally get home and I tell my mom the same thing. She's a nurse BTW. She didn't believe me and didn't even check my arm. I sat on our sofa for about 4 hours crying and saying I was in pain before she took me to the doctor. They took an x-ray and sure enough I broke my ulna. My mom never even said sorry for not believing me and I had to wear a cast and everything. Not a doctor but once had a patient claim to be a former member of a very famous sports team. Googled it and it was true. Poor guy was kind of unknown. He made the team and then quit due to various illnesses very soon after. I was the patient. When I was in labor with my son, the midwife checked me and said I was 5 centimeters dilated. Took me to the delivery suite and went off to get some equipment. I asked her not to leave as I needed to push. She shrugged it off and told me couldn't need to push, I was only 5 centimeters. I insisted to my mum I was pushing now. I couldn't stop. She ran to get the midwife, who looked a little pissed off and told me she'd check again, but it was impossible that I was pushing. Lo and behold, I was not only 10 centimeters dilated but my son was halfway out. I believe her words were something like, "Oh my god, you've gone another 5 centimeters in 10 minutes," and she rang the alarm for a second midwife to help her deliver. They were both shocked how fast I'd progressed, and my poor son was born with a bruised forehead and black eyes from slamming into my cervix hard and fast. He was desperate to get out. Patient complained of movement and itching in lower left edentulous mandible. While in my chair he reached up and scratched a hole through his gingiva and was bleeding profusely, trying to get to them and show me the wriggling things. I'm sad to say that I suggested a psych evaluation. But to be fair, I did refer to oral surgeon just in case. Even made a personal phone call to ensure warm handoff and rapid response. They uncovered some kind of parasitic insects. He healed. And I listen to patients no matter how bizarre sounding. They feel something. Nurse. I had a patient in her late 70s talk about how her mom was upstairs and died last night. I used to work neuro and so confused old people was our gig. So I just listened like whoa. Okay. And did my job. I told another staff member about how she wouldn't stop talking about her mom being upstairs and dying last night. And they said it's true. Her 98-year-old mom died in our ICU last night. I checked the roll in the morgue and lo and behold, her mom's name was on it. Well, okay then. When I was a tech in the ER, a youngish guy, maybe mid-30s early 40s, came in. He had felt weird driving to work and decided to drive himself to the ER instead. Based on his symptoms, they did some of the early testing for a stroke. Mostly as a precaution, cause what 30-year-old has a stroke and catches that early? Lo and behold, he was in probably the first 10 minutes of a stroke. The doc he was being transferred to said he had never had a conversation with a patient prior to treatment. Average time between admitting to transfer is usually 40 minutes to an hour. He was in and out 20 minutes max and completely lucid the entire time. Not a doctor but a nurse. Had a patient come in with a toothpick in his penis. Refused to tell me how it got in there. Insisting he was picking his teeth and it fell in. Ah yes. Nurse here. My confused patient told me my heart's on the opposite side. I'm not a doctor but I was at my dentist and the numbing medicine started to wear off. I didn't say anything of the sort and kind of endured it. Anyways, after like 30 seconds of enduring it, she put her hands on my head and said the numbing is wearing off. We're done. And she finished and booked me for the next week. I was shocked. I couldn't even ask her how she knew it wore off. I stayed completely still and gave off no signs of me in pain. Apparently. According to other patients, she just knows and senses this stuff. It scares me honestly. I was the patient in this scenario, but my boyfriend came home to find me unconscious and covered in vomit. The only words I could get out were "Os, I either had a stroke" on repeat. Doctors dismissed it for nearly 48 hours before someone with common sense gave me a scan and I had a bleed on both sides of my brain. Wasn't believed because I was 22 and also looked fine. Paramedic here, and not my patient but from another ambulance yesterday. It was a boy, I think about 12 years old, who believed broke his arm by throwing a ball because he heard something in his arm while throwing and then it hurt. However, he just sat in the school's gym without a great deal of pain and jumped into the ambulance by himself. Even the trauma check was allegedly unsuspicious. They put his arm in a SAM splint and brought him to the accident clinic. The team of the ambulance later asked in the hospital if the arm was broken or not because they didn't really believe him. Turns out it was broken. Obligatory, not a doctor, but I remember when I was really young, like 4 or 5, for whatever reason I put M&Ms, just regular ones, up my nose because I don't know, kids are f***ing idiots. Some of them got accidentally stuck because they were too far back. Well, I was with my grandmother at the time and mentioned that they were stuck and she freaked and took me to the ER, but by the time I actually got seen by a doctor, I guess the chocolate had melted because of my body heat, and the doctor didn't believe my grandmother because there was nothing obvious there, but finally he agreed to use a swab to make sure, and when he pulled the swab out it was covered in chocolate and my grandmother was vindicated. I dislocated my knee for the second time when I was about 18, simply sliding into a booth at a bar. Screamed at the sudden pain. And one of my friends called an ambulance. Only problem was that it had popped back in by the time the ambulance got there. They decided that I couldn't possibly have dislocated it. Fast forward about 9 years. When, after many more dislocations of my knees, shoulders and wrists, and finally a cancer scare because my boobs suddenly changed shape, they discovered that my ligaments just weren't holding me together properly. It was my physiotherapist that advised I ask to be referred for an Ehlers-Danlos diagnosis. And when I asked, I was told you can't possibly have that. Your skin springs back straight away. I insisted, and about 6 months later I was finally referred to a rheumatologist. Spoiler alert. I have Ehlers-Danlos. Not a doctor. My appendix had burst and I waited the next morning to go to the hospital. They dismissed me pretty much right away because I was laughing and joking around. After a couple HRS of waiting, I had an ultrasound and the lady said she couldn't find my appendix, so that couldn't be the issue. Makes sense, right? So she tried another type of ultrasound and found it dropped below my ovary before it burst, so they quickly gowned me and started pumping pain meds into me. And when they rushed to get the ready, I was put on the gurney and was getting wheeled in. I was still happy and joking around because I was just ready to get it out and just nervous about it all. So the doctors double checked that I in fact had a burst appendix because I should have been in a lot more pain. Nurse here. So I was doing my night shifts in ER and it was fairly calm. A guy walked in holding his crotch and he had a lot of clothes around his waist. He asked for a male doctor. There was a female doctor on call and he refused to see her. I sent a male colleague to assess him. As soon as he was done with the assessment, he peeked from inside the curtain. Pale. Apparently his wife found out that this guy was cheating on her and cut across the shaft of his penis while he was getting into bed. Long story short, he was bleeding badly and had to taken in for emergency surgery. He survived. Patient, not doctor. When I was a teenager I went to my GP with a sore thumb after a game of softball where I'd caught some other kid out one-handed at close range from an absolute screamer of a hit. It had swollen a little and bruised but didn't hurt too bad. I said I think it's broken and started to move my thumb around to see what hurt the most. The doc said, son, if it was broken you couldn't move it like that. Lo and behold, after an x-ray my thumb knuckle was shattered into several pieces, and the only reason I could move it is that there was nothing really holding it all together. I was in a cast for 12 weeks rather than the usual 6. My husband was previously diagnosed by another doctor, but when we moved to another state his new practitioner didn't believe him that the veins in one of his scrotum were knotted during the first appointment. My husband explained in detail all the studies, tests and treatment plan he's done. Even signed the release form to get records. Husband shows a practitioner what he's taking and asks for refills and referrals. The practitioner says he'll do everything request but fill the narco script because he wants to review the records first once he gets them. My husband has explained the pain to me that it is like getting kicked in the balls all the time with worse flare-ups. He's understandably frustrated that he's out of the one medication that helps and can't get a refill. The husband tells the practitioner to feel my balls. You can feel the knotted veins, pulls down his pants and whips out his junk. The practitioner agrees and pales when he feels the knot. Prescription written same day. Records were received a few weeks later.